Could a simple pill, something you probably have in your medicine cabinet right now, offer a new line of defense against one of cancer's biggest fears? Well, that's the powerful question at the center of some brand new research we're diving into. I mean, just think about it. What if a medicine cabinet staple, something you'd take for a headache, could actually help stop cancer from coming back? Yeah, I know, it sounds almost too good to be true, but a really groundbreaking new study suggests it might be possible. For anyone who's been through a cancer diagnosis, the fight doesn't just end when treatment is over. There's this constant fear that it might come back. It's a heavy weight to carry. And for folks who've had colorectal cancer, that fear is all too real. And just to give you an idea of the scale we're talking about, the National Cancer Institute is predicting that colorectal cancers are going to make up about 8% of all new cancer cases in 2025. So you can see why finding ways to prevent a recurrence is just a massive priority for scientists. So where did researchers look for a new weapon in this fight? You'd think it'd be some complex, newly developed drug, right? Nope. They turned to one of the most common and cheapest medicines on the entire planet, aspirin. And this led to a huge clinical trial with some, well, truly staggering results. Now, here's where it gets really interesting. The study didn't just look at all colorectal cancers. It got super specific. It focused only on tumors that had a particular genetic marker. It's called a PI3 mutation. Think of it like a little crack in the cancer's armor that researchers were hoping aspirin could sneak through and exploit. And we're not talking about some super rare thing here. This PIK3 mutation, it's actually found in about a third of all colorectal cancer cases. So if this idea actually works, it could potentially help a huge group of patients. So this brings us right to the core question that the folks at the Karolinska Institute wanted to answer. Could a daily low dose of aspirin, given right after surgery, specifically help those patients whose tumors had this PIK3 mutation? Could it lower their risk of the cancer ever coming back?
So how did they test it? They did it the right way, with a serious, double-blind trial. They got 626 patients, and all of them had this mutation. After their surgery, they were randomly split into two groups. One got a 160 milligram dose of aspirin every day. The other got a placebo, a sugar pill. Then, for 3 years, they just watched and waited.
All right, this is the moment we've all been waiting for. After 3 long years of tracking every single patient, did this simple daily pill actually change anything? Did it work? The answer was a resounding yes, and the results were, frankly, staggering. The patients who took aspirin had a 55% lower risk of their cancer returning compared to the placebo group. That is not a small number. Their risk was cut by more than half. And here are the raw numbers behind that big percentage, because they really tell the story. In the aspirin group, the cancer only came back in 7.7% of patients. But in the placebo group, it was almost double that, around 15%. I mean, it doesn't get much clearer than that. Okay, so this all sounds incredible, I know, but we have to pump the brakes for a second. It is absolutely critical to understand that this is not a green light for everyone to just start taking aspirin. The details here matter a lot. The potential benefit is for a very specific group, colorectal cancer survivors, after they've had surgery, and only if their tumors have been tested and confirmed to have that PIK3 mutation. On the other side of that, you have the well-known risks of taking aspirin every day, like an increased risk of gastritis and even serious gastrointestinal bleeding. And that risk isn't just a what if, it's real. In this very study, serious side effects, mostly bleeding, were seen in 5.2% more of the patients taking aspirin than those who weren't. It's a real, measurable danger. An oncologist named Dr. Joshua Lukenbill, who wasn't involved with this study, he put it perfectly. He said, low-dose aspirin is not as benign as one may think. And that's just a crucial reminder that even an over-the-counter drug carries real risks when you use it like a daily medicine. So what does this all mean for a patient? Well, the number one rule is do not try this on your own. There is a safe path forward, but it requires these 3 non-negotiable steps. First, you have to test the tumor to see if the mutation is even there. Second, you have to have a serious talk with your doctor to weigh the pros and cons for you personally. And third, if you do it, it has to be under strict medical supervision. And that really gets to the bigger picture here. Dr. Anton Bilchik, another expert, said these findings are potentially practice-changing. Why? Because it's all about moving toward a more personalized approach to treating cancer. And that, right there, is the ultimate takeaway. The headline might be about aspirin, but the real breakthrough here is the power of personalized medicine. It's this incredible idea that we can analyze a cancer's specific genetic code and then pick the exact right tool to fight that specific cancer. It all leaves you with a really fascinating question, doesn't it? If a simple pill like aspirin can have such a targeted, powerful effect, what other common drugs, just sitting on our pharmacy shelves, might be holding some undiscovered potential, just waiting for us to find the right key to unlock it?